Hi everybody, welcome to the video, and we're going to be discussing how you can find a designated prescribing practitioner in Bristol. So as always, click on the like button. I'm not actually used to saying this, but click on the like button, subscribe, like and share, and let's get into this video. First of all, let's explain to you what is a designated prescribing practitioner. A designated prescribing practitioner is an individual who's been qualified for 3 years, has experience in a wide range of areas in prescribing, has been actively prescribing, and can act as a mentor if you are looking to undertake the independent prescribing course. Now, the independent prescribing course, also known as the non-medical prescribing course or V300, is a qualification that a pharmacist, nurse, physios, podiatrists, paramedics, dietitians, and there may be a few others who can undertake this course. So it's not for everybody. It's registered healthcare professionals and allied healthcare professionals, even radiographers to some degree can undertake the course, are able to undertake this course. So it's a very useful course, and remember that the NHS is looking for solutions. We have a shortage of doctors, shortage of nurses, so if we can upskill other healthcare professionals to assist in improving access to healthcare, improving patient choice, absolutely, not only can you benefit financially, you can benefit by improving job satisfaction and patient satisfaction. So if you're watching this video, absolutely look to undertake this course itself. Now, to undertake this course, what do you need? You've got to find a university that's accredited by your regulatory body. So for pharmacists, visit the GPHC website, for nurses, visit the NMC website, and so on. Have a look at a list of universities that can or are accredited to undertake the course itself. And just a disclaimer, key thing to remember, this course is not designed to teach you thorough clinical skills. Please make sure before you go onto the course, you already have experience in an area that you would like to develop in. So if you want to do diabetes, you're seeing patients, you understand how to diagnose patients, you understand how to treat patients. If you want to do, for example, in hypertension or acute conditions, make sure you already have the experience. The course is not designed for you to expand your scope or develop your scope in another area. Key thing to remember, because a lot of students get in touch and say, I want to develop my prescribing in hypertension. And then at MEDLRN, we help these students, but we ask them, why hypertension? Do you have experience in hypertension? Can you treat it? You may not be able to prescribe, but are you advising patients with hypertension? Are you able to diagnose hypertension? Are you able to advise the GP what to start with medication? Are you monitoring the medication? You have to think of all these things. It's not a case of, well, I just take blood pressures and then I refer them to the GP. That's not going to be enough. So pharmacists in community pharmacy, I'd recommend sticking to acute conditions because you see a lot of them. Nurses, chronic conditions perhaps, and depending on your profession and what you're exposed to. And ask yourself, honestly, say, can I diagnose this condition? Can I treat this condition? Do I know when to refer this condition? Do I know the alarm features for this condition? Do I know the differential diagnosis for this condition? Have I had experience in this condition? Have I had mentoring in this condition? And if that's the case, then that's perfect for you. So you find a university that's regulated. You find your choice of or your scope of practice. You then prepare a personal statement. And then before you can apply, you need a designated prescribing practitioner. And that's the difficult one because there's a shortage of designated prescribing practitioners for various reasons. One, it's a lot of work. Two, there isn't really a financial incentive for individuals to act as a DPP. We also call it a DPP. Some of you in nursing call it a practice assessor. You may also know it as a DMP, but that wording has now changed. DMP stood for designated medical practitioner, but now we know it's not just a doctor or dentist that can act as this individual, but it can also take on this role. It can also be a pharmacist who's been qualified as a prescriber for more than 3 years, a nurse, and so on. But the key thing is, this individual has to support you. This individual is assessing you against a set list of competencies to make sure that you're competent. And then also at some point should be advising you, supporting you after you qualify if possible. So it's a very, very important role and you need the right individual to take you on this journey. So How do we find one? Where do we start? The first thing is look in your own contact book. Open up your phone, have a look at your contact book, see who is out there, who do you know that could potentially help you. After you've done that, perhaps if you're in Bristol and this focus is on finding a DPP in Bristol, there's many incentives in Bristol. Avon LPC, doing extremely well, get in touch with them. I need help with finding a DPP. If Avon LPC are not able to help, have a look at various training hubs that were set up. And at the top of my head, I think it was BNSSG. I might have got this wrong, do search it up. But they were doing various training and webinars to encourage pharmacists and other doctors to do or become DPPs. What about your local hospital? We know Bristol has a university. We know that there's also major NHS trusts. Get in touch with them as well. Primary care networks, another area. If you've tried all of this and it hasn't worked, my next advice to you would be, and I say it all the time, is start to expand your network and build your network. Go onto LinkedIn, send friend requests, connection requests to doctors, pharmacists, build your network, introduce yourself, and I'm sure somebody will help you. And if after this you're still struggling to find a DPP, get in touch with us at MEDLRN. We can help you, advise you, support you, not only with our own specialized DPPs who are trained to help and have the experience in helping pharmacists, nurses, physios, and so on, but also take you on a journey so you can expand your scope of practice and develop your skills. Now, briefly, let's talk about the course itself. It's a 6-month course. It costs around £2,300, ranging between £1,800 to £2,300. 6-month course. You have to do an exam, depending on the university that you're with. Normally a pharmacology exam, a written exam. There's an OSCE that you have to prepare for. Fairly straightforward if you have the right training and support. And absolutely at MEDLRN we can help you. What you have a case study, you take a history, and you discuss the examination if required, and so on. There's a portfolio that has to be filled out. Again, not difficult. With the right training and support, absolutely you can do it. And then you have to write an essay. And we know it's not easy when you've been qualified for a certain number of years writing essays, but honestly, there's a method to everything in life if you have the right support and the right training. Now, as always, folks, I hope you found this video useful. Together, let's make a difference. And any support you need, get in touch with us at MEDLRN. Thank you for watching. Hi everybody, welcome to the video, and we're going to be discussing how you can find a designated prescribing practitioner in Bristol. So as always, click on the like button. I'm not actually used to saying this, but click on the like button, subscribe, like and share, and let's get into this video.